For 2 years, scientists have reviewed a torrent of research coming out on vitamin D, concluding people need to take a bit more vitamin D, but not much.
We are quite convinced that this is adequate intake, and these are recommendations for all Canadians.
The panel suggests boosting the current intake levels primarily to keep bones healthy, from 200 to 600 international units a day for adults. Those over 70 should take at least 800 units a day. And they added it's likely safe to take up to 4,000 units a day.
Although those intakes may still be consumed, there is no additional benefit to taking in these reports, at least as far as we can discern.
Vitamin D advocates who wanted much higher recommended intakes say it's a small step in the right direction.
What's happened is there's a tripling, 300% increase in the vitamin D recommendation for everybody from 1 year old until 70 years of age.
But others maintain even more vitamin D is better, boosting the immune system and possibly cutting the risk of some cancers. That's why the Canadian Cancer Society says it will continue to recommend 1,000 units a day.
I would take it one a day.
And why Dr. Linda Rapson herself will continue to take 4,000 units a day.
I think it's improved my immune system. I'm sure it's improved my muscle strength.
She routinely prescribes similar doses to patients. This new limit may safeguard bones, but she says it won't protect people against other conditions.
If they stick to it really carefully, is that there will be a significant percentage of the population who will be suboptimal and their health will suffer for it.
Health Canada still has to formally accept the recommendations of this report, but we noticed on their website this afternoon, Lloyd, that they had in fact bumped up the recommended intake of vitamin D.
Well, there's certainly going to be confusion about this, Avis, because these researchers are recommending doses lower than those recommended by the Canadian Cancer Society of 1,000 units a day. So what are Canadians supposed to take from this?
Well, it's totally understandable people will be confused, but we can try and clarify it this way. This report is based on bone health, and based on the science, they believe that all we need is about 600 units a day. They did not look at all of the research suggesting that higher doses might help with things like colds and flus, multiple sclerosis, or cancer. They decided to leave that aside because they said the science wasn't clear enough and that more research needs to be done. But what's interesting is that the Cancer Society said that despite the report, they stand by their recommendation of 1,000 units a day to prevent cancer because of the research that they've seen.
Are there concerns about side effects, and can you take too much vitamin D?
Well, what's interesting is that the report said that up to 4,000 units is safe, and a lot of people that you talk to are taking 2,000-3,000 units, so that seems to be safe. They did notice some problems at 10,000 units or more a day, where they said they were signs of kidney and tissue damage. But then again, the advocates of vitamin D say that's still pretty safe because you get far more than that just from spending an hour in the summer sunshine.
Well, thank you for those clarifications, Avis. Avis Favreau.